Kylie.
And I'm Amy.
And we're going to be going over the patient appointment protocol with you today to kind of explain what each step throughout those appointments look like.
All right, so we're just going to start right off the bat. When we greet the patient in the waiting area, we want to actually walk out to the patient, shake their hand, welcome them to Castle Peak Dental or Avon Dental. Take the time to really make them feel welcome and like they made a great choice by choosing our offices. We're going to go ahead and then bring them back, making small talk as we're walking, and then seat the patient. Keep that small talk going, like show genuine interest in the patient, trying to get to know them, finding out like why they're here today, if they're new to the area, just anything that could just help build a little bit of a relationship right off the bat.
For example, if Amy was my patient, if she was a new patient, I would seat her in the chair and say, are you new to the area or just new to us? And that would create, if she's been in the valley for quite a while, or she just moved here, which opens up an even bigger conversation of where she moved from, what made her move here, things like that. And then from there, I could kind of spur into what brings you in today. If she was an existing patient, I would seat her down. Maybe if I've seen her for a long time, ask her about her family, how are they doing, have they taken any trips lately, how's their winter been going, things like that. And then we can kind of go into if they have any concerns.
Yeah. With new patients, we always want to explain what the visit's going to look like. We start off by, again, thanking them for choosing our office and letting them know that the visit's going to be about 90 minutes. You can just say, for example, Susie, we're so glad you're here today. We do have you scheduled for a new patient exam. We're going to, start off by taking a full series of x-rays, or we might take the panoramic and the more, how do you explain it, Kylie?
I usually say, because in Avon Dental we typically do 4 bite wings in the panel for new patients due to our doctors really focusing on oral surgery. And so I'll always say we're going to start with a panoramic image. That's one that's going to go all the way around your head, and that allows us to check the surrounding structures to the teeth and rules out any bone cysts, tumors, or abscesses. We can also take a look at any of your wisdom teeth if you have them left. Then I'm going to take the close-up cavity detecting ones that you bite down on the sides, and that shows us if you have any cavities occurring between the teeth.
Then we'll explain to them that we're also going to be doing a comprehensive evaluation of the gum tissue, just checking for any inflammation or infection in the gum tissue, and then we'll explain, the difference between just a healthy mouth, gingivitis, and periodontal disease. So you can say it very simply, like I'm going to be taking a little ruler and we're just going to measure the space between the tooth and the gum tissue, and that helps us to determine if there are conditions that we need to address.
And then I usually follow that up with, after we assess the gums, we'll get everything clean today, and then you'll be meeting Dr. Blank, and let them know in advance which doctor they are going to be seeing so they can already kind of start to build that relationship in their mind. And they're going to be doing a full mouth exam today and notating any areas they see of concern, and if there are, we'll definitely put those on a treatment plan for you so you can see what to expect.
If they are a patient of record and this is a recare visit, we do want to ask about any changes in their medical history, if they've had any surgeries or any new medications that they're taking or not taking anymore, and if they have any concerns today that maybe they didn't have 6 months ago.
So just to clarify and make these steps real simple, what we can do is me and Amy are going to kind of act out what a new patient initial sit down and assessment looks like versus a recare patient. So for this first step, I'll pretend that Amy is my patient and she's a new patient to the office. So I went to the waiting room, shook her hand, thanked her for choosing Avon Dental or Castle Peak Dental, and then made small talk along the hallway, walked to the room. And then I'll seat her and just kind of sit face to face with her. And so, Amy, are you new to the area? Just new to us today? Kind of that small talk again.
I'm just new to the office.
Oh, perfect. So you've lived in the valley for a long time? Excellent.
Yeah.
So you've seen it go through lots of changes or just been here a couple of years?
It's grown a lot since I moved here.
It has. Even the few years that I've lived here, I've seen lots of changes. Well, what brings you in today?
I'm just due for a cleaning. It's been a while.
Okay, perfect. Do you have any concerns as far as sensitivity, discomfort?
No, not really.
Okay, just want to get back on track.
Mm-hmm.
And how long has it been since that last cleaning?
A little over a year.
Okay. Perfect. Well, you're here now, so we're going to get you back on track. And then I was just looking at your health history. No major medical concerns.
No.
You don't have any medications that you're taking. Perfect. No allergies that you're aware
No.
of. Excellent. And then we do have kind of a questionnaire that goes into what their main focus is as far as is it cosmetic, longevity, function of the teeth. So that can kind of trigger some conversation too. If I see that she notated cosmetic is a bigger concern of hers, I can look to her and go, so I noticed that you're interested in cosmetics. Anything specifically that you're curious about?
I was kind of hoping to whiten my teeth and
Okay.
maybe look at braces, just
Okay.
getting my teeth straightened.
Yeah, any history of braces in the past?
No.
Perfect. So you're ready to jump in now?
Mhm.
Excellent. And this is where it can open the gates to, I can explain to her about our different whitening options and go into Invisalign and the benefits of doing Invisalign versus traditional orthodontics to introduce that conversation. And while I'm going through the assessment, I can continue to tie things back to that whitening and orthodontics. So that way it ties into what she's actually interested in. So I'm not kind of opening the gates to something she's doesn't want to know anything about. Then I would look to Amy after we had that. So what I'm going to do today, since it's your first time with us and it's been about a year since your last visit, I'm going to be updating all your images today. And that's what I go into. I'm going to be taking that panoramic image and the close-up cavity detecting ones. We'll be checking those numbers along the gum line for your gum and bone health. We'll get everything cleaned, and then Dr. Josh is going to be doing an exam today. Any questions about anything before I get started? Perfect. So that's how that initial conversation would go with a new patient. So then Amy can now demonstrate, with me being the patient, what a recare one would look like.
Hey Kylie, how was you and Ben's trip to Europe?
Oh my gosh, it was amazing. Long overdue, but I'm so happy that you remember. Thank you.
Yeah.
It was a great time.
You guys are checking off a lot of those destinations.
We're definitely trying. That's our goal.
So any changes in your overall health, any surgeries or medication changes since
No,
last time?
everything's all still the same.
Perfect. How's that tooth been that doctor adjusted last time?
A lot better. Yeah, thank you. It just, once he made an adjustment about 2 or 3 days later, that chewing discomfort went away.
Perfect. And is there anything today that you wanted him to really focus on?
No, kind of the usual. I still have that generalized cold sensitivity when I brush and stuff, but nothing different with it. It's all still staying kind of the
Do
same.
you feel like the fluoride kind of helped a little bit after
It
that last
does. I
visit?
noticed for the first couple months afterwards it helps. It just gradually kind of comes back. But like always, I'm using that Sensodyne and stuff.
Perfect.
So.
Good.
Yeah.
Awesome. Well, we can get that painted back on today at the end of the visit.
Perfect.
And keep you on that regimen. I think it's helping.
Yeah, it seemed like it did. It made a
Yeah.
difference. So thank you.
Yeah. And so then with our recall patients, what we'll typically do is try to alternate between taking their yearly bite wings or their full mouth perio charting, just so that we can sort of even out the time on those visits so that they're not due for x-rays and perio charting at the same time. And I think that all of the providers in the hygiene department are trying to do that, just as a general rule.
So then Amy could explain to me as a recare patient, all right, Kylie, it looks like we updated those images last time you were in, so today we're just going to be checking those numbers along the gum line and the cleaning and exam today. Or, so it does look like you are due for those images today, we're going to update those and then get started on the cleaning. And then that way, again, even though they're a recare patient, they still know exactly how the appointment's going to be running today.
Yeah. And we do have 60-minute visit protocol and 90-minute new patient exam protocol that is in that onboarding packet that you kind of glance at. But there are doctor exam expectations also. So certain things that need to be collected in a 20-minute assessment on a recare patient, and then about a 40-minute on a new patient. So kind of get to know what those expectations are on those, but we'll go through them in a little more detail right now.
So if you flip through your onboarding packet, you're going to see how those assessments break down. There is the new patient 90-minute appointment breakdown, and then there's also the 60-minute, right here, breakdown that shows exactly what occurs during those appointments. So it kind of makes a little checklist for you, and you can actually time out how long you're spending on each section to stay on time. And so again, going back to if Amy was my new patient, so I already had done the introduction, I already told her what we're going to be doing today. She had no questions. Great, let's go ahead and get started. So with that new patient, within that 40-minute assessment, I'm going to be starting off by taking her x-rays. After I finish that, I'm going to lean her back and start with my oral cancer screening. And I always explain to them I'm just going to be doing an oral cancer screening, checking around for any lumps or bumps or areas of concern. While I'm doing that, we can still be creating small talk and making them feel welcome the entire time. After I finish my oral cancer screening, that's when I usually go into checking any hard tissue findings. So I'll be documenting and updating any existing restorations that they have into their chart, because we always want a full existing record on them. So whether it's root canals, implants, missing teeth, existing amalgams, or composites, we want that all charted. After I get those charted, I go through and do a full mouth set of intraoral photos on the patient. And I explain to them, I'm going to be taking some photos of your teeth today, just so we have on record, and then that way each time I see you following this appointment, we can check for any changes that occur. And if changes are occurring, we have true photos to look back and see how quickly it's changing. I also just like to take these so I can show my patients what I see. And so I'll take all of those. When we do take those, you'll see this image behind us. In the patient's DEXIS chart, it splits it up. There's one view that you can do. If you hit this little plus sign in the upper left, it breaks it up into a full window of their images. All bite wings, FMXs, PAs, everything like that, it's going to go in this upper left area. Any panoramic images go in the lower left. And then the right side is used for intraoral photos. We prefer and want everyone putting intraoral photos in this lower right section, because if you put them up here, you can't number them. So they're just going to go into long lines, and then the next person that's going, or if you see that patient again, it's really confusing, and you're like, wait, which tooth was that? So if you double click and you open this window, and hopefully you can see, when you double click in this lower right, it's going to make it bigger, and when you hit the little intraoral sensor button to start taking them, you can instantly start taking those photos right here. And as you're taking your pictures, once you're done, you hit the exit button and the screen will pop up to allow you to number them. So once I'm numbering them, yes, I do it with my patient in the chair, but while I'm numbering them, it's usually behind them. And again, that's where I'm just kind of, have you done a lot of skiing this winter? Any trips planned coming up? Oh, tell me about that. How's work been? What is it you do? So while they're talking to me, telling me something, a long story about themselves, I can start numbering all these images. Once they're done numbered, you'll see they're aligned exactly where they belong. So that way it's really quick and easy to reference that specific tooth.
And I think the easiest way to do that so that it's not confusing is to start on the upper right, go to the upper left, and then down to the lower right. That way they're kind of in order already. New patients, we do want a full mouth intraoral photos, which would be each molar, the premolars together, a full arch shot, and then a smile shot. This patient doesn't have that.
Caught her on mistake. But that's we always want on new patients full mouth sets of intraoral photos. After I take my intraoral photos, that's when I explain to the patient I'm going to be checking those numbers along the gum line, looking for any areas of severe inflammation or bone loss that has occurred. So then I start my perio chart. I'm also going to make sure I'm not only charting the pocket depths, but all recession, mobility, and furcations as well. They also have an area that you can chart bleeding. And so we do want full perio charts of all that information for our new patients. And I always explain to them, first I'm going to start by checking those numbers along the gum line. Then, once I finish those, I inform my patient I'm going to look for any areas of recession. I explain what recession is, because it's kind of surprising sometimes that patients have no idea what that is and never been told they have it. So I explain what it is, measure it. Once I finish my perio chart, I explain to them what I found. So again, if Amy was my new patient, I would say, all right, Amy, so what I'm looking for with those numbers is around each tooth, the gums make a pocket, and I measure the depth of that pocket. 1s, 2s, and 3s are good, healthy numbers. 4s is kind of that puffy, red inflammation. We call it gingivitis. 5 and higher usually indicates bone loss is occurring, and so that gingivitis has advanced into what we call gum disease. If gum disease continues to advance, more bone loss occurs, and teeth can become mobile, and then we can lose them because we don't have that structural support around them. what I'm finding today is, and that's when I can open the door of how they're looking. So if they're healthy, I let them know I'm seeing all those 1s, 2s, and 3s, great job. Let's talk about what you're doing at home to help that continue to look this way. If I'm seeing some 4s, that's when I go into that means that gingivitis. Good news is we can reverse it at this point, but here's what we're gonna need to be doing. If I'm seeing that they are in that gum disease phase, I'm gonna have that talk with them right there and explain exactly what gum disease is. Sometimes we'll have some little picture chart examples that you can use and models, and then explain to them what we need to do to get that back on track. And then after going through that, let's say she is healthy, but she has some recession, I'm going to tie back into that fluoride that I recommend to help with those recession areas, some things that she needs to do at home with her toothbrushing, not using an abrasive toothpaste, and kind of give her some direction. So now that's leading into my OHI with her. After I finish any OHI, then I'm going to pull these photos around them. You can either sit them up or pull it over the top of them, whatever you're comfortable with. And then I'm going to go through any findings, hard tissue-wise, that I see using these photos. So that way, when doctor comes in, they're not surprised by anything doctor has to say because I've already explained it. So with this particular patient, if these were Amy's, I would go through and show her what good, healthy composite fillings look like. There's a little bit of stain that's occurring around these, but as long as they're staying sealed, we continue to keep an eye on them, really focusing on these chewing surfaces when you're at home brushing them, and keep getting that fluoride in your toothpaste at home and here in the office to help these continue to stay healthy. Then I'm going to click ahead to a tooth that's more concerning, such as a large silver filling. And so I would show this image to them and say, what we're looking for with silver fillings is, and kind of go into concerns with them. So over time, they expand, they contract, they can create voids between the filling and the tooth. When those voids get too big, bacteria can leak up underneath of them, which can lead the risk of root canals. So we always want to remove those and replace them before it leads to needing a root canal and a crown. So with this tooth, I see a concern right here where there is an opening. So bacteria can leak up underneath this filling. And we're seeing this dark gray shadowy area, which means bacteria is already leaking up underneath the surface. So likely doctor's going to talk to you about wanting to clean this out and replace it with a tooth-colored filling. And so that has already been discussed. That way when doctor comes in, there's no surprises when he looks at this and says, yep, I do recommend that we replace this filling.
And depending on the size of the silver or amalgam restoration, we may have the discussion of what a crown is, and they may recommend a crown. And I think you're not diagnosing, but you're just educating the patient on what's going on in their mouth. So you don't actually have to tell them what they're going to have, but you just have to let them know that there's a concern, and it's an area that you're going to have doctor check.
Mm-hmm. And so, kind of to wrap all that up, I've done my x-rays, I've done my oral cancer screening, I charted existing work, I've taken intraoral photos, words are hard, and then I updated any perio findings, reviewed what I'm finding, reviewed my OHI with them, showed them their intraoral photos so they're aware of what's going on in their mouth. If she did have that interest in Invisalign or straightening, I would discuss the pros and kind of what treatment entails with that. At that point, my 40 minutes of my new patient assessment should be up, and then I can ask them, do you have any questions, or tell me what questions you have about anything we discussed thus far. Nope, everything makes sense? Perfect. Let's get started on that cleaning. Before I lean her back and start on that cleaning, I'm going to send a blue note to doctor, letting him know that my assessment is done. And so that way doctor knows that my assessment's done, they can now come in for the exam. What we like to do is we're actually wanting doctor to come and interrupt us during the cleaning. So that way if there is a treatment plan that's needed, we can finish up with the cleaning while the front office is getting the treatment plan printed off and ready. So that way there's never a time where the patient is just sitting around, or we're sitting around waiting on something to happen. So what we typically do is we have to kind of decide how long do we think this cleaning is going to take. Are they very healthy, there's hardly any buildup, so it's probably going to take me about 15 minutes, or is it going to lean more on the 20-25 minute side? And with that being said, let's say Amy had, it's been about a year, she has some more moderate plaque accumulation, it's going to take me 20 minutes to truly finish this cleaning. So I would then blue note doctor and give him a timeout of 20 minutes from now. And then that way he knows from now until the next 20 minutes would be a great time to come in and get my exam done.
We have found that definitely helps allow time for treatment planning and for just wrapping up the appointment, so that we're not waiting till that very last minute of the appointment time and then scrambling to get everything done and then running late for the next patient.
Mm-hmm. So that's leading up through the assessment and up to the cleaning on the new patient. Amy can now go into detail again with what a recare looks like.
So with the recare, the assessment time is going to be a little bit shorter than with the new patient because we're mostly just updating. If it's an x-ray day, you're going to take whatever films they are due for. If they're due for an FMX, we do take those every 3 to 5 years. Same with the Pano and 4 bite wings. And then we update perio charting if it's not an x-ray day. Excuse the phone ringing in the background. If it's not an x-ray day, we're going to do the full mouth perio chart, and you are, again, like Kylie mentioned in the new patient assessment, we're going to be doing full pocket depth measurements. We're going to update recession, mobility, bleeding, any changes that have been made, and you're going to just address any changes with the patient. You're going to explain to them what's going on, and then if they aren't due for the perio charting and you did x-rays, it is still a good idea to go through and just spot probe any areas, that maybe were a problem before, or that have been in the past, just to make sure that we're not losing ground. We don't want to completely ignore the perio charting, but you don't have to do the full assessment and record it on the recare patients if they're not due. But once a year, we are doing that full mouth perio chart. And then again, with a recare patient, we are going to go in and we're going to take intraoral photos of any existing watches, any silver fillings that we're kind of monitoring, staining in the grooves, areas that have had high diagno readings in the past, if there were fibromas or just abnormal tissue, just anything that we need to have record of to watch progression or changes. That should be done every visit. Am I leaving anything out?
No, that sounds great. Just to clarify with that recare, you're not doing the full mouth, you're just doing specific areas that were of concern that we're monitoring for the time being.
Yeah. On somebody that's thinking maybe they want to do Invisalign and they've got that lower anterior crowding, that's a great picture to have every year, and then also build up on the linguals of those lower anteriors. That's a great photo also. And then, or if they made improvements and maybe they don't have the buildup that they had last time, that's a great way to just kind of celebrate something that they're doing right.
We don't always take intraoral photos just to kind of talk about the negatives. It's also about the wins as well.
Yeah.
And so, like Amy said, that assessment's going to be a lot quicker. So that's looking more at 20 minutes or less.
Yeah.
You would start by taking their x-rays, like she said, and then oral cancer screening, then leading into spot probing. Again, if they weren't due for x-rays, you would just lean them back, do the oral cancer screening, and then the full mouth charting. Both scenarios, you would update any specific intraoral photos of concern. Again, leaning them over the patient and having that talk with them again, and setting the stage for when doctor comes in for that exam.
And then, like we did with the new patient exam, we're going to give that time out for the exam. We're going to blue note doctor, let them know the assessment's done. We've kind of talked to the patient about anything that we're concerned about, and then we're ready for the doctor to come and interrupt us. And we kind of want them to interrupt us so that we're not waiting at the end of the appointment. Usually it's that 15 to 20 minute time frame that you want doctor in and out by.
And then going back to now, we've moved past the introduction, the assessment, we are now into the scaling portion of the appointment. With that, for the new patient, again, it kind of determined what we were seeing with them, if they're a healthy patient, a gingivitis patient, or a perio patient. If they are that gingivitis patient, we are really trying to make sure we're using the correct codes. So that's that 4346 code, which is gingivitis therapy, meaning we're scaling in the presence of gingivitis, but there's no bone loss that has occurred yet. So if that's what the patient is displaying with, we've already had that explanation to them during the OHI and explained that we do need to do this more advanced cleaning called gingivitis therapy to help get them back on track. We always print out a treatment plan that's going to show them financially what to expect for that more advanced cleaning, so that way when they leave, there's no financial surprises. That's one thing we never want to do, is for them to go up front and not realize that they owed something upon leaving. So I will have grabbed that treatment plan with the gingivitis therapy on them, reviewed it with them, they signed it, and then I can go ahead and get started on that today. I always give my patients the offer if they want like Orikix or some numbing gel, just so it's more comfortable on their gums. If they are a true periodontal patient, I, again, already had that discussion with them of what that entails, what the treatment entails. If I feel like I have time to get started, at least on a quadrant of that SRP, I will give them that option and let them know we can get started on that today. If they would like to, again, you have to do the same thing. We have to print that treatment plan, review it with them, have them sign it, so again, there's no surprises when they check out financially. And then we would be doing that cleaning, and then hopefully doctor will come in and interrupt us mid-cleaning. For the recare, it's a lot easier.
Yeah, much easier. Same as what Kylie said with the new patient, you're just gonna kind of rehash kind of what we're seeing, and then
and it's going to be more, again, with the recare, just that basic scaling. So you're typically not going to have to sit them up, do treatment plans or anything like that. It is possible with a recare that if it's been about a year, they're a little bit past due, and they have had gingivitis problems in the past, and now they're displaying with gingivitis again, you may have to sit them up and re-go over that treatment plan, even though they are a recare patient, because we always want to use the correct code. So if they truly are displaying with that generalized bleeding, inflammation, pocket depths of 4s, we need to inform the patient. It's only good for them that this is what they're displaying with, and so this is the type of cleaning you need today. And then if they're displaying with everything healthy, stable, great, you just move on into your prophy.
If it is still fairly healthy, but they do have a few 4s with some bleeding, a great thing to offer is just the LBR, or the laser bacterial reduction, and that can be done that same day. I think both offices, it's about $29. And it's just a great adjunct. You can just say, this is something that's going to kill more bacteria than just the instrumentation alone, and it's going to help with healing, kind of a biostimulator, just gets us back to healthy a little bit faster. Just a simple add-on that can be really helpful in those patients that maybe did display some regression, but they're not the 4346 code, and they're not perio.
And with those quick little add-ons like the laser or fluoride, you don't have to print a treatment plan and have them sign it. You can verbally just tell them this is going to be $28 today, and we'll get it taken care of for you. Or the fluoride, like I kind of said earlier, I am recommending we do that paint on fluoride to help prevent any changes from occurring. It's only $23 if your insurance doesn't cover it. That way they're fully aware, okay, $23 is what I owe upon checkout. But you don't have to print the treatment plan like you do if you're going to do that more advanced cleaning. And so once you finish, again, once you're in the middle of your cleaning, hopefully doctor at this point will have come in and wanted to start the exam. With that being said, we have a chart in here in your onboarding packet that goes over when doctor comes in for an exam and kind of a checklist. Now, when we meet with you personally, we'll go over more specifically kind of what this exam looks like and entails and how we do it depending on which office you're in. But just as a basic outline, you're always going to introduce doctor to the patient if they've never met them. And so for new patients, that's a given. You're always wanting to seat the patient up, never introduce the patient to the doctor laying down. So you're going to seat the patient up. Typically what I like to say is when doctor comes